Canada, as you know, is going to start talking about how and when to legalize marijuana. Doctors have been talking about this for a while. It is a syndrome. It's called CHC. It causes cycles of non-stop vomiting, nausea, very intense stomach pain that can't be treated with medication. And the only thing that offers relief, it seems right now, is a hot bath or a shower. Dr. Raj Waghmare is joining us in studio to talk about this, which, of course, you have been seeing more of, I guess, in the emergency room where you work of. So let's backtrack a bit and tell me the full name of this condition and what seems to cause it.
So it's Cannabinoid Hyperemesis syndrome. Nobody really knows what causes it for sure. A lot of patients start taking marijuana or using marijuana to help symptoms like nausea. Again, patients use marijuana to help symptoms like anxiety as well. And often what marijuana does is it reverses itself. It starts doing the exact opposite. So for these patients, they start having recurrent episodes of nausea and vomiting, as well as epigastric pain, severe pain. And for some reason, these symptoms get better with hot baths or showers.
You're seeing this more often where you work?
I'm seeing it probably 3 or 4 times a week in the emergency room.
And is it a relatively new diagnosis, or has it been so rarely used we just haven't heard of it before?
It's relatively new in terms of medicine. It wasn't around when I was in medical school. It was first described, I guess, in about 2004. A lot of physicians have not heard about it. So it's something we're seeing more, we're hearing more. There's a lot of it on social media. So a lot of it is just trying to elicit the symptom from the patients. Do you have severe nausea, vomiting, these recurrent episodes? And then just kind of getting in, do you use marijuana? Do hot baths make this better?
How often are patients using marijuana in the cases that you've seen?
These are heavy users of marijuana.
Meaning
often.
what?
Daily users, 3 or 4 times a day. Sometimes it's 2 or 3 times a week, but for many years. When it was first described, there were saying that only patients who used it many times a day experienced these symptoms. But now what's being said is that the concentration of THC in marijuana is much stronger, that not as heavy use is needed for this syndrome to manifest itself.
And when you get these symptoms, do they stay with you? Do they come and go? What are you seeing?
The symptoms come and go. I've seen patients have these symptoms for as long as 13 days in hospital. Often what happens is patients come into the hospital with severe epigastric pain, nausea, vomiting. We give them intravenous medications, morphine for pain, anti-nauseants. Nothing works. So after a while, they often get frustrated. They want to go home, and symptoms settle down within a few days after cessation of use. Often patients don't want to go home. They want more narcotics, more pain medications, because the pain really is so severe, and they have to be admitted to hospital.
Is this something we need to worry about as we see marijuana become legal in this country?
I would think so.
Tell me why. Are you worried about younger people, for example?
Most of the patients we see are younger people in their 20s. I wrote a case about this on my blog. That was a gentleman in his 50s. He was a businessman and accountant, and he had been to his doctor many times. He'd been fully investigated, CAT scans, scopes, blood tests, ultrasounds, and nobody had ever asked him, do you use marijuana? When I saw him in the ER, he just volunteered it, that a hot bath really makes this better. And so I asked him if he used marijuana, and yes, he did. He was a daily user.
Wow. All right. So it's something we definitely have to keep a watch for and see, I guess, if people are using it more and will be using it more often when it does become legal. Thank you for joining us today.
Thanks for having me, Marla.
All right. Health officials in New York are treating 33